This is a video about chiropractic adjustment. The chiropractic adjustment video from the series of the videos dedicated to the launch of our app, the Back Pain Center app, designed to connect chiropractor with the patient with chiropractor, with physiotherapist, with the sports therapist who all work at the clinic, designed to answer all your questions quick, inquiries quick, and if you want anything explained or shown, we'll do it directly to you, either through a video or voice message or personal conversation or a phone call. Just give us a buzz, tell us, and we'll do it for you. So this little short video, because they get lengthier as I'm getting used to recording them, is about adjustment. Well, there are a few things about chiropractic adjustment. The thing number one, they're not like you see them on the loud cracking wire strap adjustments on YouTube. They're not like that. Chiropractic adjustments are very specific and very safe. Okay? Specific means that they're not just a pull of the spine and the wrench of the spine and hope that all the joints gonna crack. That's not chiropractic adjustments. So if you see that, that's not chiropractic. If they claim it's chiropractic, whatever, it's their own choice, right, to show themselves like that. Specific means that the chiropractor assesses your spine either before the adjustment or when they do the adjustment to feel and test which joint is not moving as well as it should. And often if you had adjustments with us, you had that. You heard us commenting on your, saying, look, on your spine, so this one is not moving, right? So we're trying to move the joints which are not moving to make them move better, shall we say. Joints don't move, that's another point. Joints don't move anywhere, they stay where they are. So you cannot move it in place, out of place. It's just a saying. When people say that, it's just a saying. You can't actually reposition the joint from one place to another. What happens during the adjustment is that the joints which are stiff, they just go pop and they start to move better. They remain where they are, but they start to move better. And you may hear the pop, you may not hear the pop. This still happens. With a loud or quiet pop I hear or you hear or none of us hear, it still happens. Okay? So specific, meaning we're finding this particular joint and we're moving it. It can't be done with a wire strap, whatever it's called, towel, as you see on some videos, crazy videos. It's probably beneficial, but it's very dangerous, right? And it's not specific. Same with the lower back. You cannot just wrench the lower back, hoping. Don't do that. We feel. The real chiropractic adjustment is when chiropractor feels the joints and they try to find one which is not moving as well as it should and helping it to move better. That's what chiropractors do. So I already done 2 points. Not necessarily loud cracking. Very specific. Okay? The third point, the good chiropractic adjustment should not be painful. The adjustments are not painful. They can be quite deep, they can be quite loud, they can be overwhelming, especially in your neck, but they are not painful. The only times when chiropractic adjustment can be painful is if the joint we are moving painful anyway. It is inflamed, it is sore and angry, it is stitching like that. So when we do the adjustment, often it is a momentary, there's a short and light pain. The joint actually opens up, but it's never getting you worse and it's never excruciating. It just can be slightly unpleasant when it happens. But if the adjustment is done to a correct person at the correct time, in the correct way, speed, force and rate, it will be relieving. Maybe slightly uncomfortable. You may feel discomfort, but you'll be relieving. That is a real chiropractic adjustment. So that is a very important point to know about chiropractic adjustment, okay? What else? Chiropractors adjust the whole spine. Chiropractors believe the spine works top to bottom in synchrony. Each joint helps next joint to move better. So you can't just come with a low back pain, adjust the low back and hope for the best. That doesn't work. You adjust low back, mid back, upper back, neck, upper neck, and not just go like a tractor through the field. Chiropractors feel which joints in need of improvement and they adjust these joints. It's very important, okay? This is for people who watch these crazy videos and look for crazy cracks and they think the crack will be just like changing their life. Yes, it will, but it's not like that. It's much more specific, painless. Another important thing about chiropractic adjustment, it is short and fast. Okay? Short in the way of translation, in the way of depth. It's short and it makes it very safe because your joint doesn't go through this big, deep, yeah? It doesn't do this. The joint is brought to a certain position and then the movement is very small and quick. It creates, again, safety for the patient because of the speed of the adjustment. The body doesn't have enough time to react and tense and create the barrier for this adjustment, creating the damage and the trauma. Because of the quick and light but very fast adjustment, the trauma doesn't happen and the joint has enough time to release. So it's very good that way in chiropractic. Speed, specificity is important and it must be painless. Okay? So we'll see you soon for your next adjustment and please download the app. Thank you.